Doctors of Reddit. What was your worst? I don't think this is important, but patient. Being a doctor is both exciting and dangerous. They have an exciting job and encounter a wide range of patients on a regular basis. Some of the interactions are worth remembering, and today our Redditors who are doctors share similar experiences with us. A couple of years ago, when I was a student, during an exam, I had to examine a patient. Talk to him about his medical history. Have you ever had surgery? No. So, you were never hospitalized? No. I finish the history and tell him to remove his shirt to do a physical. First thing I see, a big scar in the middle of his chest. Sir, how did you acquire this scar? Oh, that's from my open heart surgery a few years ago. Yes, it was a minor procedure. Nothing serious at all. I'm a pediatrician. Newish mom there for a 6-month-old baby. Baby cries, she turns and yells at her kid in the ear for being loud, turns to me calmly and asks, how old they gotta be before you can give them? Whoa, calm down, lady. Had a lady that fell once at work. I knew by the way she went down that her hip had to be broken. My colleagues were just so sure that it wasn't broken, and I even went against the doctor and ordered her x-rays. All because she wasn't crying or saying it hurt. That pelvis was broken in 3 different places, plus the femur head was also broken. That lady never once complained of pain, even walked on it. She had dementia. I've often wondered if some forms of dementia just cannot feel pain. That might be a new discovery. Did an FME, which is a full mouth extraction, on a guy. Halfway through, he's bleeding constantly, excessively. I was only a dental assistant for about 3 months at the time, so I didn't know much about the health part. Doctor was freaking out and we couldn't get the guy to stop bleeding. Finally, he tells us after about 2 hours that he's on blood thinners. He came back the next day with his son and he was still heavily bleeding everywhere. We had to call an ambulance to go to the ER. I am now OCD and over-excessive or cautious about medical history before any procedure because of this. People really should tell their doctor everything before any procedures. Intercepted a young woman who was just hit by a car. Her boyfriend was standing with her freaking out. I do a basic physical exam and get a history and make her comfortable as we wait for the ambulance to arrive. Once the ambulance arrives, they ask for the same information, except this time the boyfriend mentions that he was the one who was actually hit by the car and was shielding his girlfriend's body. The entire car's windshield was cracked by the impact of his back. He was just freaking out and worried about her and was in shock and hadn't begun to feel any pain yet. That was a close call, buddy. Had a male in his 50s walk into trauma to have his left thigh stitched up. Not an uncommon wound in an agricultural area. Speaking to him while stitching him up, and he tells me he fell off a ladder while cutting a branch and the machete sliced him on the way down. Told him I was going to write him up for an x-ray of the entire leg just in case, but he kept saying he was fine. His knee just hurt a bit, but logically it was from that fall. I agreed, but asked him to go to x-ray department just in case. He reluctantly walked there and back. X-rays showed a helical fracture almost the entire length of his femur. Besides being a dangerous fracture, the femur is supposed to be the most painful bone to break, and he was walking around. In the end, I had to show him the break and to get him to sit down in a wheelchair and into the hands of the orthopedics. That man's pain tolerance still impresses me. His mind was too powerful to accept the injury. Had a patient come into the ER with some sort of spider or bug bite on her hand that had progressed to a red line running up her arm. She stated that she put Benadryl cream on it and it was very itchy. We continued talking and I asked if she had any allergies. Yes, Benadryl. I thought, good lord, WTF, and I'm sure it was reflected on my face. We washed the Benadryl cream off her arm and miraculously it stopped itching. Now that's an honest mistake. I once checked in on a guy and asked him if he had any previous surgery. No, never. When I examined him, he had a surgical scar just above his pubic bone, just below the sternum. Well, what's that then? I asked. He stared down at it and said, I've never noticed that before. What the f? He must have lost his memory. Emergency radiologist here. I see plenty of people presenting with understated symptoms that turn out to be mind-blowing advanced diseases. The saddest one was probably the 4-year-old boy who presented with a rigid abdomen for a few months. Was told by their pediatrician it was constipation months ago, but his parents never followed up and it didn't resolve. When I imaged his abdomen, I found his entire liver was replaced with a mass consistent with hepatoblastoma. I asked the parents why they waited so long to work it up. They said they were satisfied with the diagnosis of constipation. That one left a mark on my soul. They must not have anticipated it. This 20s guy came into the hospital. He had a lot of conditions where he couldn't make it past 40, and he currently had some infection. We kept giving him antibiotics, which helped, but not as much as we would have liked. After about a week of being in the hospital, I walk in and I'm talking to him, and he tells me that he got medically necessary circumcision on his last admission to the hospital. I ask if that's okay if I take a look to make sure it's healing okay. It was black with all kinds of infection. I am not sure how a 20s married man or his wife never thought to tell anyone about this for the past week. He must have been embarrassed. Everyone at my company knows the story of the patient who came in for genetic counseling, went through their whole family history with the counselor, and then concluded with, "Oh yeah, I was adopted as a baby, and I don't know who my birth parents are. Does that matter?" Did bunion and hammer toe surgery on a lady with no allergies. New patient packet, primary care note, all had no known allergies. I always ask about metal allergies anytime I plan on putting in hardware. Surgery goes great. I'm on call for the practice and receive a phone call for the group 18 hours post-op. Her nerve block had worn off and she was in excruciating pain. Give instructions on what to do. Next morning, she's in my office before even I arrive. 10 out of 10 pain, sweating profusely, blood pressure elevated, foot is massive, clearly not faking it. Have to send her to the hospital for intractable pain. Blood work indicates elevated eosinophils, but everything else is normal. No blood clot or infection. Hospitalists convinced of its complex regional pain syndrome. I rack my brain and think, what the could be going on? I am only 5 months out of residency. My puckering so hard. Since eosinophils are elevated, ask if she's allergic to jewelry? Yeah, my tongue swelled up when I had it pierced. I had it removed the next day. She had a freaking nickel allergy. No allergist will see her to confirm this, so this is all speculation, but it makes sense with the hardware I used. Once the hardware is removed and exchanged for titanium, her pain is resolved. There was one case in my residency of hardware allergy, 1 out of 3 cases I was first or second to assist on. If I didn't scrub into that case, I don't know I could have figured this out so quickly. Crazy case. And now I always ask, have you ever had any reactions to jewelry? A lot of patients won't tell you about problems with jewelry, and they may not even know that they have metal allergies. So have you had similar encounters? What would you do in such circumstances? Comment your thoughts below, and please like, share, and subscribe.